Hello, my name is Julia Lankus, and this is my husband, Tim Lankus. Tim has graciously agreed to be my model for the physical assessment video. Throughout this video, I will be explaining the system I'm assessing, what I'm assessing, and noting when I am assessing cranial nerves 2 through 12. I'll be using an otoscope, an ophthalmoscope, a reflex hammer, a tuning fork, and a ball of cotton. Before we begin, let me wash my hands. So our first assessment is a mental status exam, which begins just by an across-the-room assessment. So I'm looking at Mr. Lankus's demeanor and his affect, and at this time he appears to be well-groomed, he's engaged, he's active participant in this physical assessment. Later on, toward the end of our assessment, I will build in some cognition and memory tests to kind of sum up our mental status exam. So our first physical part of the assessment will be of the head and the neck. I'm going to start simply with an inspection of his head, face, and neck. And as I'm looking for any abnormalities, any skin lesions, any sign of disease, anything that could be of concern that has been a problem for him in the past or is currently an issue. And now, Mr. Lankus, I'm going to gently palpate your head. Do you have any problems with your skin?
No.
Any problems with your head or your neck?
No.
Excellent. And now I'm moving on to the neck, and I'd like to see you swallow for me. Fantastic. Do you have any difficulty swallowing?
No.
With my thumbs, I'm going to gently check to see that the trachea is in a midline position. Can you swallow, please? And there is no deviation of the trachea. To check for vascular anomalies, I'm going to gently check with my thumb and my forefinger. And again, there are no abnormalities. For the thyroid exam, I'm going to move behind Mr. Lankus to assess the thyroid gland from both sides. So I'm going to start here on the right side, gently palpating. Can you swallow, please? Thank you. Excellent. And then on the left side, I'll use my left hand with the 3 fingers and gently palpate along the side of the gland. Once again, can you swallow? Thank you. So if you can give me a big smile, thank you, and a frown, and if you'll puff out your cheeks, fantastic. So there's evidence of cranial nerve 7 is intact and working well. I'm going to use the light to check first in his nares, and then if you can open your mouth and say, ah.
Ah.
Excellent. Cranial nerves 9 and 10 are intact as evidenced by his ability to swallow and his ability to say ah. And I noted no abnormalities when I checked with the light in his nares nor in his mouth. So we're going to move on to the eye exam. And we're going to start by assessing cranial nerves 3, 4, and 6. If you can just turn toward me a little bit, I want you to just follow my finger. And please don't move your head. Excellent. Thank you, Mr. Lankus. So there's proof our cranial nerves 3, 4, and 6 are intact. And now we're going to do a visual acuity chart, which I happen to have a wonderful app on my cell phone that has the Snellen chart in it. And I use this frequently when I work in the adult ER. So, Mr. Lankus, I'm going to move 4 feet away from you. Do you wear glasses?
Just when I'm reading.
Okay. So if you can cover one eye, and this is about 4 feet, if you can please read the smallest numbers on the chart, or the letters on the chart.
FELPZD.
Excellent. And then if you cover your other eye.
FELPZD.
Fantastic. So you are 20, I can barely see with my glasses. 20/25 is your far vision, which is still quite excellent. And that also is an assessment of cranial nerve 2. Additionally, for the eye exam, I'm going to carefully inspect his eyes, his lashes, his eyebrows, and then I'm going to gently pull down on the conjunctiva so I can see a little bit more into the eyes. He has no redness, no edema. His eyes are in excellent shape. I'm going to use the ophthalmoscope, first of all, just as a light to assess his pupils. So for purposes of the video, please pretend that my lights are dimmed and that this actually lights up, because it doesn't. So I will bring the light in. Mr. Lankus, if you will just look straight ahead. Fantastic. So that pupil constricted well to light. And then on the other side. That is wonderful. So now we're going to do the ophthalmoscope exam, where I'm going to examine his eye with the scope, and I'm going to gently, if Mr. Lankus, you'll try not to blink, come in and place a finger on his cheekbone and look with my same eye so that I can visualize the retina and the lens and the optic disc. And I will do the same thing on the other side. And once again, there are no abnormalities. For our 5th cranial nerve, I'm going to take a cotton ball and touch it on your forehead, your cheek, and mandible. And so if you can just let me know if this feels the same. Excellent, thank you very much. And now for the ears. For the ears, I will be using an otoscope. So I'll prepare that now. Here we go. But initially, I'm just going to inspect the ear and gently palpate the auricle and also assess the mastoid bone. And the same thing for his right ear. Palpating the auricle and assessing the mastoid bone. And then with the otoscope, I'm going to gently lift the ear up and come forward so I can visualize inside the ear. The tympanic membrane is pearly white and intact. And it is the same on the other side. I'd like to conduct 2 hearing tests to assess cranial nerve 8. I'll be doing both a Weber and a Rhine test. So the Weber test, Mr. Lankus, you're going to let me know if you hear the sound equally in both ears. Excellent. And for the Rhine test, once again, I'll place the tuning fork on the mastoid bone, and then if you will just let me know when you no longer hear the sound. Excellent, thank you. And then we're going to do a whisper test, which is a hearing test. So I would like you to plug the ear farthest away from me, and I'm going to whisper something, and I want you to repeat it back. Let's try the other ear.
I love horses.
Yes. All right, you have better hearing in your right ear than in your left ear. We're now moving on to the respiratory system. Let me quickly grab my stethoscope. And with the respiratory system, I'm just going to begin by inspecting. For the privacy of this video and Mr. Lankes' privacy, I'm not going to lower his gown, but I am going to tighten it a little bit so that I can see the rise and fall of his chest. I'm going to gently palpate so I can feel the rise and the fall. I'm moving around to the back so that I can check the thoracic expansion. So I'm going to put my hands just below the rib cage, and Mr. Lankes, take a deep breath in through your mouth and out through your mouth. And again. Excellent. The thoracic expansion is fantastic. So now I'm going to begin by percussing between the ribs. And for the other side. I'm going between the intercostal spaces. And I'm going to percuss on the back as well. If you can take your arms in front and cross them for me, and just lean slightly forward. Excellent. There's a great deal of consistency with the sounds, so I'm not concerned. But of course, I'm going to auscultate to continue the exam. I'm going to start above his clavicles. A lot of people are not aware that the lungs actually extend above the clavicles, so I'll start my auscultation of lung sounds through there. And Mr. Lankes, I would like you, bless you, just to simply breathe with your mouth open. Inhales and exhales through your mouth. Can you open your mouth, please? Big breaths in and out of your mouth. Thank you. And now for the back. If you'll cross your hands over your chest again and lean slightly forward. I'll start above the clavicles. breath sounds are clear in all of our lobes. Thank you very much. Let me last check the mid-clavicular line. If you can lift this arm just up above your head, and 3 more deep breaths. And the same thing on the other side. Thank you. The respiratory system appears to be normal. Now moving on to the cardiovascular assessment. So initially, I'm inspecting simply his skin color. And if I can have a hand, please, I'd like to assess his capillary refill, and it certainly is under 2 seconds. I'm going to check his radial pulses. And Mr. Linkous, I'm just going to lift the bed up here a little bit. I'm going to ask you to lie back. I have a sheet for you. If you can lay your head back, please, and turn your head to the side. I'm going to gently check his carotid pulse. And turn your head toward me. Excellent. So pulses are excellent, and capillary refill is fantastic as well. I'm going to gently palpate with the heart. I'm going to move to the other side of Mr. Linkous because my dominant hand is my right hand. So I'm going to gently palpate under the heart to begin with. And alongside with my hand facing up. And on top. Mr. Linkous, are you on any cardiovascular medications?
No.
So I'm going to start with auscultating, and I'll start at the second left intercostal space, and then I'll move across the sternum to the patient's second right intercostal space as well as his third space. So I'll be starting at the aortic valve and then moving across to the pulmonary valve. The aortic and pulmonary valves are working wonderfully. I can hear the second heart sound, which is the dub of the lub dub. I can hear that clearly here. I'll now move down to the tricuspid valve and then the mitral valve. The heart is loudest at the apex of the heart, and I can clearly hear the first heart sound here, which is lub. So we have lub and dub from the apex to the base. I'm going to listen to these same landmarks with the bell of my stethoscope, additionally also checking the carotids, and I'm assessing for any bruits with the bell. and I do not hear any abnormalities. So for the purpose of this exam, we're going to defer the breast exam, but breast would be assessed for symmetry, size, color, shape, discharge, and they would both be inspected and palpated. And of course, for women over 40, there would be yearly mammograms. Exam. I have Mr. Lankes's gown lifted up, and I've got his privacy protected here. So I'm going to inspect the abdomen, and then auscultate, and then percuss, and then finally palpate. So in the inspection, I'm simply visualizing his abdomen, looking for any abnormalities, any areas that are distended, and his abdomen looks flat and free moving even with his breathing. So now I'm going to listen in all 4 quadrants for bowel sounds. His bowel sounds are active. Now I'm going to listen with the bell of the stethoscope for any bruits over the aortic artery, the femoral, and the iliac arteries. There are no bruits present. Finally, I'm going to percuss, keeping in mind that the sound will vary. Over the liver, it will be a little more dull sounding, versus over the bowel, it will likely be more hollow sounding. I've gone up into the rib cage between the ribs here to continue to percuss the liver. And finally, the abdominal exam is finished with palpation. I'll start out lightly. Let me know if you have any discomfort. And then a little bit deeper. Excellent. Thank you very much. The genital exam will also be skipped in this video, obviously for privacy purposes. In the male, the penis and scrotum would be palpated, as well as the inguinal canal checked closely for hernia, palpated as well. In female, the external genitalia would be inspected and palpated, and the internal would be inspected with the vaginal speculum, and then often tests are run as well at that time. We're going to finish our exam. We're drawing near the close with a musculoskeletal exam. So I'm going to move our bed up. Mr. Lankes, you can sit up as well. And if you want to just hang your legs over the edge. Please pretend this is a reflex hammer. If you can relax your legs, we're going to start with the lower leg exam. So I'm going to check the reflexes. Excellent. Mr. Lankes, if you can lift your hands up above your head and bring them back down. Make a fist. Lift your hands up, push against me. Okay, pull back. Excellent. I'm going to put my fingers there and squeeze as tight as you can. Fantastic. I just want to see range of motion. Do you have any difference of range of motion with either arm or leg?
No.
And if you could stand up, please. You can turn toward the front. Make sure that your gown is down. And if you can reach your hands above your head again, excellent. And then bend forward. I'd like to see what your flexibility is. Are you able to touch your toes?
Yes.
So if you could go back down, please. I'd like to inspect your spine. Okay, fantastic. And your hips. You may have a seat again, please. So for our final, we're looping back around now to mental status. So I'm going to ask Mr. Lankus to recall the words that I whispered.
I love horses.
Excellent. He remembers them well. And now, for cognition, I'm going to ask him to count backwards by sevens, starting at 100.
93, 86, 79, 72,
And one more.
65.
Excellent. Thank you very much. That concludes our physical exam for the health assessment class. Thank you.